updated PHAB Guide webinar. This webinar is co-hosted by the Public Health Foundation and the Public Health Accreditation Board, PHAB. Before we get started, we'd just like to go over a few housekeeping items so you know how to participate in today's event. Today's webinar is being recorded and it will be archived on PHF's website at phf.org. We've taken a screenshot here, an example of the attendee interface, so you should see something that looks like this on your own computer. For audio, you have the option of listening through your computer's speakers, or you can check the telephone option to view the dial-in information. Throughout the webinar, you can submit questions via the questions feature below. You can send in your questions at any time. We'll collect and address them during the Q&A session at the end. If you have any technical issues, feel free to type in the chat box. Someone will assist you as soon as possible. And the presentation slides are currently in the handout section, which you can see on your interface. You can download them now. You can download at the end of the presentation, and they will also be archived at phf.org. And again, this webinar is being recorded and will be archived. Thank you also to the Centers for Disease Control and Prevention for co-hosting this webinar and funding this webinar with us. And then I'd like to introduce today's speakers. So we have Margie Budry. She's the Senior Associate for Performance Improvement Services at the Public Health Foundation. She's responsible for assessing technical assistant needs and managing delivery of on-site workshops, coaching, and facilitation for health departments and their community partners. She has over 30 years of experience in public health and health sciences research, project management, psychometrics, and change leadership. Our other presenter is David Stone. David Stone is the Education Specialist with the Public Health Accreditation Board, directing the development of educational services for PHAB and the Public Health National Center for Innovations. Before joining PHAB, David was Accreditation Administrator for the North Carolina Local Health Department Accreditation Program. David also has over 30 years of public health experience, including 7 years as Local Health Director in Surry County. They're excellent resources, and I will give it to Margie to get us started.
Thank you very much. Good afternoon or morning, everyone, again. I want to start by just talking about the learning objectives for our time together. We want to use this time for a couple different purposes. First, to recognize the features of a performance-minded culture in general, and of course we'll apply that to the PHAB application and preparation process specifically. We'll be helping you to understand the steps in the PHAB process and lessons from the first wave of accredited health departments and how PHAB has responded to those lessons. We're going to consider how PHAB has applied the principles of performance improvement to the accreditation process via the revised guide to public health department initial accreditation, which we refer to as the guide throughout this discussion. And finally, planning to avoid common pitfalls and apply performance-mindedness while using the guide. I want to just quickly reference a few things about the Public Health Foundation. We provide resources, training, and technical assistance to support your work in quality improvement, performance management, and workforce development. Many of these links that you see on the slide here connect up to the accreditation process. For example, the Public Health Improvement Resource Center is a repository of improvement-related resources that are organized by the 12 domains of accreditation and the 10 essential public health services. Also on our website, the Performance Management Toolkit includes resources and information about the public health performance management framework and how to implement it. So that's just a sneak peek at some of the resources available through Public Health Foundation to supplement what we're talking about today. So I want to start by talking about the features of a performance-minded culture. And in the context of accreditation, we're really talking about performance improvement. It really is about performance improvement. Firstly, critical thinking, self-examination, data-driven decision-making, and customer responsiveness. It's meant to have a positive, simultaneous impact on the public's health, on the agency's operations and the well-being of public health employees. And preparing for accreditation goes far beyond just jumping through the hoops and assembling the documents that meet specifications, impressing site visitors, and the various elements that you already know about. Those elements are necessary, but they're not sufficient. Developing self-consciousness about and perhaps even a preoccupation with performance improvement is really the glue that holds all of these together. Performance-mindedness happens at many levels, at the organizational agency level, at the department or the division level, within teams, and of course at the individual performance staff member level. And it's important at all of those levels that we think about and become aware of the value of performance-mindedness in our work. So let's talk about the first of those 4 elements, critical thinking. You see here, a description. I mean, everyone thinks. It's our nature to do this, but most of our thinking left to itself is biased. It's distorted, it's partial, it's uninformed, and can be downright prejudiced. And yet the quality of our life and that of what we produce and make and build depends precisely on the quality of our thought. And shoddy thinking is very costly, both in money and in the quality of our lives. Excellence in thought, however, has to be systematically cultivated. So when we look at critical thinking, we're looking at these elements, that it raises vital clearly and precisely, uses critical information that's pertinent, and arrives at well-reasoned conclusions and solutions and tests them over and over again, openly considering different perspectives, recognizing and assessing assumptions, implications, and practical consequences of those assumptions, and having an approach to problem analysis that is focused on solution identification and implementation. It's experimental, it's iterative, it's incremental. This is all part of critical thinking. The bottom of the slide, and again, I think Vanessa mentioned you have access to these slides in your handouts. There's a reference to a lot more information around critical thinking concepts and tools, but that's just a quick overview. Next is data-driven decision-making. And we think about, this concept, I'm thinking about the need to improve organizational processes and performance using valid measures, accurately describing indicators, and recognizing that not all numbers are important or are created equal, and reliable measures that are stable regardless of who does the measuring, when they're done, and so forth. And the use of both qualitative and quantitative data. Data-based decision-making. Numbers can dispel myths and enable critical thinking and self-examination. Data-informed decision-making needs to recognize that not all that is important is a number. There are some bits of information that are not captured in numbers, that are captured more in experience and in the way that folks describe that experience. I think we missed one, so I'm going back. Sorry. Customer responsiveness meant to be second. So everyone recognizes that there's a need for authenticity in our work with one another, in our work with what we refer to as customers in our work. The customers may be folks within our own organization. They may be the general public we're dealing with. They may be members of the media. They may be our funders. They may be our legislators. These are all different forms of customers. And the need for authenticity, both internally and externally, is critical. Acknowledging how decisions impact others, both downstream and upstream, and taking responsibility for the way that impact happens, and effectively communicating. This is all part of being responsive to our customers. And the reason this is an important part of performance-mindedness is because we have to be able to listen and respond to customer needs in order to maintain a high standard of service. This is all, I recognize, very theoretical at the moment, but let's hang in there for one more. Boy, these slides are sliding so quickly. I think I must have missed one. Self-examination doesn't seem to be in there. I don't know where it is, but I'm just going to go ahead and go through it. Self-examination is a default orientation that promotes continuous improvement. It has to start from within. We run to criticism. There's no room for defensiveness. We're always seeking input. There are no sacred cows. The status quo should be challenged. That's part of self-examination. We're always looking for a new perspective, a preference for out-of-the-box thinking, and actions that are self-directed and self-disciplined, progress that is self-monitored and self-corrective. So performance-mindedness really depends on folks being able to be examining their own actions and those of those around them. So in a nutshell, performance-mindedness throughout the accreditation process, very important to all of those different elements, both at the organizational level and working our way down. And I think for the next slide, we'll kick it over to David.
Thank you, Margie. I'm going to do a brief overview of the steps of the accreditation process, and this will include and reflect some of the changes that are included in the new guide that we're talking about today. And I cannot seem to get the slide to move forward. There we go. So the first step, of course, is the preparation phase, which was previously pre-application. And we have changed this to preparation because that's what we have found is really a need throughout the entire process, is constantly working on that preparation. And as Margie said, developing that performance-mindedness as you get started and as you begin. And in the preparation phase, it's an intentional step that was added by PHAB, and it is really important to be prepared to undergo the process. And we have found in some instances that the outcome was not as well as it could have been for those that got started before they were really ready. So the level of preparedness is predictive of how well the documentation is assessed and whether the health department may receive an action plan. Meaning, of course, that the better prepared an applicant is, the less likely that they will have measures reopened or corrected. Based on a health department, this step can take a various amount of time. And during this step, the health department is really doing a self-study, a self-assessment of its own readiness to determine what needs to be done before submitting an application. And a part of this step is really beginning to know and to get a good understanding of the standards and measures, beginning some discussions on what documentation the health department will submit, and making sure that they have the right interpretation as far as the requirements go. Also during this preparation phase will be a time when the health department is developing its staff capacity to go through the process. They'll be selecting an accreditation coordinator, hopefully an accreditation team, and the coordinator and the department director must complete the online orientation. Now, a common question that we get is, well, how do I get started? And we'll go over that later as a part of this webinar. Next, please. So, after this time of preparation, a health department registers the health department in EPHAB, PHAB's web-based information system. This takes the place of the old SOI, or Statement of Intent. And so they register, and the same information is put in that was in that old Statement of Intent. And then when that's accepted, in the system, then they receive access to the application. Once that is submitted, the application is reviewed for completeness, and then it is likewise accepted by the system. Once the application is submitted, the department has committed to the process and is responsible for the full fee, and that's whether they complete the process or not, and irregardless of the outcome. So after that application has been reviewed, an invoice is generated, and it's sent to the applicant. And then the accreditation coordinator is required to attend an in-person workshop, which is paid through the fees for the process. And then after attending this learning event, the department then moves to the next step. Next, please. So here we are in the documentation selection and submission step. One thing to note is it is not self-contained, so all your documentation work does not occur here. This is the time when you are making your final selections and you are uploading them into EFAB. So EFAB is a permission-based system. So once the department has attended the learning event, they will gain access to the tab for documentation submission. The department has up to a year to upload and submit, and once the department has submitted its documentation, PHAB will conduct a completeness review of all the measures for basic documentation requirements. For example, is the document dated? Does it have its evidence of authenticity or signatures? Are the number of examples correct for the requirements? Things like that. The completeness review is not an assessment of adequacy of the documentation. We leave that to the site visit team. And then for any reopened measures as a result of the completeness review, the health department has up to 30 days to respond. When the health department has responded to the completeness review, a site visit team is assigned to them, and when the submitted documents are open to the site visit team or released to them, then the next step is considered underway. So here we have the site visit team being assigned. The site visit team is a peer group, other public health professionals. The pre-site visit review of documentation and the on-site review at the health department both comprise the site visit. And so once the documentation has been through the completeness review, it's released to the site visitors. Usually that's a 3-person team, and they divide up the domains based on their expertise. They will spend approximately 8 to 10 weeks reviewing the evidence and having team calls to discuss. Now that can range anywhere from 6 weeks up to 12 plus, and generally that is always based upon the completeness and the quality of the documentation. Sometimes scheduling can get in the way, but for the most part, it's the time it takes them to review and discuss the documentation. After the review of all measures, questions and any requests for additional documentation are sent to the applicants by reopening these measures. And again, the health department has 30 days to respond to that. So while the site visitors are finishing up their review, PHAB is working with the health department to set the dates for the site visit. And that visit is primarily a tour of facilities and lots of interviews. And then once that site visit is finished, the site visit team will submit a report, which again is reviewed by PHAB for consistency. And then when it is finalized, it is forwarded on to the Accreditation Committee, which takes us to the next step. So we get to step 5, which is getting the decision of accreditation status. And this is done by the Accreditation Committee, which represents and is appointed by the board. It's made up of board and non-board members, and it generally meets quarterly, but they have put in extra meetings based on the number of reports that they must review. 2 committee members conduct independent reviews of each report, and they independently either recommend accreditation or an action plan. And then the full committee discusses those recommendations and they come to a conclusion. Now, if they are accredited, that status lasts for 5 years. If not, then an action plan is given. And if the action plan is not submitted or the implementation is not accepted, then the department is deemed not accredited. But upon a first review of the site visit report, there is never a status of not accredited given. The action plan is always a part of that process, and that's exactly what PHAB considers it to be, a part of the process where the health department is continuing to gather documentation to satisfy the board's feelings as far as the needs they need to do to become accredited. Okay. Oh, yes. So here is the action plan timeline. This did have some changes as a result of the new guide, and this went into effect back in November. And you can see the flow as it goes from the top left around the right and curves down around the bottom. But essentially what has changed is that PHAB will review the draft action plan. They will provide some feedback. PHAB has a template that can be used by the health department. This is to help with consistency of what goes in front of the Accreditation Committee to make sure that they have answered the appropriate questions and that they are looking at the issues that the Accreditation Committee put back forth to them, and to make sure and try and avoid an aspect of a confusing plan and not really knowing what it's saying. So this goes to the Accreditation Committee. They will accept it at that point, or they could reject it, asking for changes to the plan. And if they reject it, it goes back to the health department. They have 60 days to review that and make the changes and then resubmit to the Accreditation Committee. Now, the first round of developing the action plan, the health department has 90 days to do that. And then it moves on through the process. If the plan is rejected again after this second round, then the health department is deemed not accredited. If it is accepted, they go through the process of developing new or selecting other documentation. It is again reviewed, and the Accreditation Committee reviews that and determines accreditation, or if it's not accepted, then it's not accredited. But to date, all action plan reports and implementation that has come before the Accreditation Committee has been accepted, and those health departments have been accredited. Then we get to the next step, which is annual reports, and all accredited departments are required to submit an annual report. It is a statement that the health department continues to be in conformity with all the measures, and the focus is on how the department is addressing the opportunities for improvement that were noted by the Accreditation Committee. So in part one, that's where you will find that information, working on the follow-up. Also, are there any significant changes in the department that could affect their ability to be in conformity, such as changes in leadership, resources, any kinds of laws or statutory changes, those kind of items that could come into play there. Now, part one is required, and not submitting part one could affect your accreditation status. That is, if you miss one or two or three or stop sending them in, then you could lose the status of accreditation. Part two is not required, but everyone to date has submitted it, and it is a part of both PHAB and the board's wish that this is and continue to be and develop as a quality improvement process, keeping in mind again that performance-mindedness Margie was talking about. So in part two, the health department talks about their quality improvement and performance work. They give a couple of examples of quality initiatives or performance initiatives that they have done in the past year. And this section is reviewed by PHAB's Evaluation and Quality Improvement Committee. They look through these, and they do develop individual feedback as far as what they are doing, quality and performance, offer some suggestions or offer some comments on their initiatives, and that goes back to the health department. Part one is reviewed by PHAB staff, and any follow-up from that goes either back to the health department or to the Accreditation Committee. And then we get to our final step. Reaccreditation is being developed and finalized now. It will be voted on by the board in December and released in January of 2017. The standards and measures are out, and they have been vetted by the public health community for those that wish to put in comments. I believe we received over 500 comments on those. So that information now is being reviewed and changes made based upon the feedback that we've received. One interesting thing here is the standards are the same as the standards we have now, but the measures will be different. So there will be a separate set of standards and measures for reaccreditation. And it is going to be more of a self-study, self-analysis kind of model. So lots of the documentation will be narrative on aspects of updates, telling us what you're doing now, things like that. There will be some updated documentation that will be provided in some instances. And then as this is reviewed by the site visitors, trends and patterns and themes will come to light, and that's what the site visit will be based on. Accreditation must be, reaccreditation I should say, must be completed by the last day of the quarter in which you were accredited. So for example, if you were accredited in July, then you must complete the process by the last day of that quarter or September 30th. Reaccreditation will be an EFAB. It will be electronic, just like the initial accreditation, and applicants must participate in all steps of the process as they will be defined. There will be some training and webinars that will be provided, and there will also be a guide to reaccreditation, just like the new guide for initial accreditation.
Okay, so this is Margie, and we're going to talk quickly now about the lessons from the first wave of accreditation. We've talked about the features of a performance-minded orientation to accreditation, and David has walked us through the different steps of the accreditation process. And as folks know, there were many health departments that went through the accreditation process and applied in the first couple of years that PHAB was accepting applicants, and many of those health departments were accredited, and some were not. And there were lessons, even among those that were accredited, that PHAB has learned from and have been used to update the guide and the process. So let's talk about those. One of the big lessons from the first wave was that these 7 steps, the ones that David just talked about, although they may have been named slightly differently in the first round, these 7 steps were approached in a very linear way. So we started with step 1, and then we moved to step 2, and so forth. Folks were sort of wrapping up step 1 before moving on to step 2 and moving on one step at a time. And while that makes a lot of sense on the face of it, it actually is a little bit of a liability. You do this and then you do that. You finish this before you move on to that. So when you're doing step 1, the pre-application phase, you're completing your prerequisites. In step 2, you're doing your application. In step 3, you're finding and assembling all your documentation and submitting them. 4, you're getting ready for the site visit and hosting the site visit. 5, you're waiting for an accreditation decision. Next, you're doing your reports. Once you're accredited, your annual reports and your quality updates, and then the reaccreditation piece was preparing for a repeat of everything you did before. This is the order in which people were approaching and thinking about accreditation. Here were some observations that came out of that. Linear thinking was a very big drawback. Some of the elements got less time and attention than others. Some were sometimes less than they really needed. And the elements that were developed later were often constrained by elements that were developed earlier. This was a kind of checking the box orientation that happened. PHAB noticed that some health departments were arriving at training unfamiliar with some of the important requirements and key documents. For example, folks would have put in their letter of intent. They would come to they would come to the PHAB office for their training, and they were professing not to understand what a performance management system was, what a workforce development plan was, what a quality improvement plan was. So developing these items really does require significant time and effort. And so if a health department was waiting until they were that far along in the process to begin thinking about these documents, it would not necessarily have sufficient time to complete them in conformity with the requirements of the standards and measures. And these additional requirements were adopted in an effort to encourage health departments to be ready to successfully complete the process when they apply for accreditation. What I mean by these additional requirements is that under the new guide, before you would ever come to training, your health department will have indicated that it has made significant progress or has completed all of the plans and guidance documents that are required. There are something like 8 of them, I believe, and so this is happening in a more simultaneous way. The other thing that happened due to the linear orientation that started off as the PHAB process was that planning was often very siloed. There were missed opportunities to apply performance management and quality improvement to preparations for accreditation. There was linkage missing and alignment missing among the various goals and timelines of the required plans and policies and systems, and missing linkages among the activities that were being done to implement and monitor the effectiveness of those plans and policies and systems. So for example, you consider your performance management system, it has the potential to be a system that allows you to manage performance and progress and track needs for improvements against all of the other plans related to accreditation. The performance management system can track your strategic plan, it can track your quality improvement plan, your workforce development plan, your preparedness plan, your branding strategy, and so forth and so on. But if you don't get around to starting to develop a performance management system until those other things are all in place, then you may miss that opportunity. Under the new guide, we're encouraging a more circular approach to these steps. Here are the same 7 steps, but in this case what we want to do is, while you're doing preparation, you want to be thinking ahead to the site visit. What will site visitors be looking for? What will help them to understand who you are as an organization? And what do you need to be doing early on to anticipate those needs and be ready so that you're not scrambling before the site visit? After the site visit, what has that taught you about your preparation? And when you are getting ready for example, the next round of reaccreditation, what lessons did you learn there? So these kinds of circular thinking, very important to making sure that we're not just doing these one thing and then finish it and move on to the next, but that we're constantly referencing what this is all about and how it's going to relate to the next step that's coming into the steps that have already passed. One of the other observations that happened that came about as a result of the initial wave of accreditation was that action plans were very, very common. About 1/3 of applicants have been asked, this is across all of those who've applied for PHAB, have been asked to create action plans. The source of this is that many health departments in some instances were applying too early before they were ready. They weren't really able to assess whether they were ready, and the critical thinking to do that was often missing. There really wasn't the foundation. Plans were in place, but they really couldn't show how they were building on the foundation they established with those plan documents. They hadn't really started to implement those plans. Perhaps they had a workforce development plan, but they weren't doing anything to make it come to life. Domain 9, within this context, Domain 9 was commonly a very weak link. So Domain 9, most of you know, is focused on quality improvement and performance management. So here are the skills then to do this kind of critical thinking and this kind of improvement across the accreditation process. But if you haven't got a foundation in Domain 9, you're handicapped in all those other areas as well. So this is one of the things that we saw over and over again. Whoops, sorry. And then the other observation is the need to recognize it takes time to do this well. Putting all these pieces in place needs to be the focus of initial accreditation activities, and then to start to implement and apply the discipline of continuous improvement long before you ever get to a site visit. Because once you start to do that, gaps will emerge. This is a guarantee. The plan looks like one thing on paper, and when you start to implement, you notice the things perhaps that maybe you hadn't anticipated, or the ways in which those plans need to be tweaked in order to respond to emerging issues. So that implementation is a precious opportunity to really practice applying quality and performance improvement mindset as you're rolling a plan out. It's not just a plan on paper, but it's a plan in action. And once the plans are developed and rolling, you really need at least a year to get things working in a coordinated way. So you can imagine, if you think back to the reference I made before, if you were arriving at your PHAB training and you'd already submitted your application and your clock was ticking on documentation, but you didn't really even understand yet what a workforce development plan was or what a performance management system was, you can imagine what a disadvantage that would be and how far behind you'd always be. And the result of that was that people were rushing through it, and rushing through it never pays off. So let's take a look now at the old versus the new guide, and I'll let David take it from here.
Thank you, Margie. Yes, so I'm going to give a couple of things as far as changes that are a part of the new guide. The guide is the official PHAB description and statement of the process. It's considered policy as far as PHAB goes. The new guide was adopted in June of 2015. Some portions went into effect in November, and all changes went into effect as of February of this year. So, as I mentioned, there will be a guide to reaccreditation as well, and the new guide is referred to as a guide to initial accreditation. Besides describing the steps of the process, there is also appeal policies and what can be appealed to the PHAB board, generally regarding a decision that the Accreditation Committee has made. The guide also has a section where it defines eligibility criteria to apply for accreditation. And then there is detailed information, including timelines, for each of the 7 steps. Here is a table that lists out the changes between the old and the new, what was changed. This can be found on the PHAB website under the Accreditation Process tab, and that link is also on the resource slide in today's presentation. But that's a good way to look at what exactly did change and where can I find it in the guide. So let's look at the major changes there. As I mentioned a few minutes ago, talking about the steps, the statement of intent, the SOI, is no more. The initial intent of that was to use it as a workload guide for PHAB to think about, how the applications would be coming in, but it was never used in that regard. And so this was changed to a registration, which includes the same information that was in the SOI. Registering just puts your department in the EFAB system. It does not commit you to the process. You have 90 days to complete the registration and move on to the application, or if you do not finish it up and submit it, then the account is archived and you would just start all over again if you wish to enter into the system. One other change is that with the application, you no longer submit the prerequisites. As a matter of fact, the new guide does not even refer to prerequisites. Officially, that is no more, although we still refer to the health assessment, health improvement plan, and the strategic plan as the 3 prerequisites. But instead, as a part of the application, you will, or an applicant will agree that these are complete along with some other plans, and we have that listed in a moment. Of course, we've mentioned that one of the steps name was changed and then registration was added to the second one. The big changes really is making extensions and inactive status official policy. We had been doing some of that before on a case-by-case basis, but it's now part of the process, and I'll define those a bit more. Finally, the Health Department's review of the site visit report for factual errors has been deleted. We found that in the vast majority of instances, it was not correcting an error, but it was the Health Department arguing the assessment or the score of a particular measure. The Accreditation Committee never even looked at these comments to begin with and did not consider them in their deliberations, so this was just dropped. Now, extensions are granted to an applicant, and as you see there, because there is some kind of extenuating circumstance, something that is beyond their control, and it is significant enough that they can't complete a step of the process within the time frames that is set by PHAB. Now, examples here could be something such as a fire or a flood to a facility, and we have had that happen. If there is some kind of public health emergency or outbreak in that jurisdiction, and pretty much all of their time and resources are going to addressing that. Or perhaps if there is an unanticipated change, such as the health director and the accreditation coordinator leaving at the same time, and we've had something like that happen. So it's when things like this happen, the health department can ask and get an extension to whatever particular step or phase they are currently in. Now, we need extra time is not considered a legitimate excuse. It might be a legitimate situation, but it's not accepted for an extension. That would come into play when we talk about inactive status. This is a case where more time is needed to properly prepare or complete the activities of a step. Usually it's involving documentation. During inactive status, PHAB is locked down and the applicant cannot revise or upload any documentation. They do have read access, so they can see what's in there, but they can't make any changes. And when an applicant goes into inactive status, there is a fee of $100 a month, which primarily goes to pay for the licensing of PHAB. That's one part of the fees as well. It pays for that licensing that each applicant must pay. PHAB may suggest that a health department consider inactive status, or PHAB could require it based on the situation. So, for example, PHAB may require it if the documentation is in such poor condition or such a poor state that it can't be reasonably corrected within required time frames. So, for the most part, inactive status is employed in the process during that documentation submission phase, step 3, which is 12 months. It could be a response to the staff completeness review, where they have the 30 days to respond and they may need much more. Or it could be a response to the site visits team's review of the documentation, again, where they, in the process, have 30 days to respond, but it could take much more. For example, we had one department that had over 70 measures reopened out of 101 during the completeness review. And this is a situation where PHAB may say, we're putting you on inactive status so that you can correct this. And then the health department itself may request it, and site visitors could even recommend it to the department. So here's the main timelines in the process, and we talked about most of these. Extensions are 30 days up to 6 months is generally the time that is granted there. Margie? Margie, we can't hear you.
Hi, can you hear me now?
Yes.
I'm sorry about that. I was on mute. Thanks, David. Here we're going to talk about how we then apply performance-mindedness to this new timeline that David just described. And on this slide, you see I'm going to walk you through different ways that you can leverage performance-mindedness opportunities throughout this process. On the left-hand column, which is labeled typical practice, There are several things that I'll talk about. So let's take a look at the first one. The first one is you're going to focus on how to do the prerequisites, which used to be called the prerequisites, but we now think of as the strategic plan, the health assessment, and the health improvement plan. And you can certainly do that and do only that. But what you could do, in addition to focusing on that, is you could become familiar right away with all 8 required plan systems and policies. I think of them as the plans in general. But rather than focusing on just those 3, which used to be called the prerequisites, that we focus on all of the things that are going to have to ultimately work together and in coordination and in alignment. Next, you can write the goals and objectives for each of those plans that you have to submit to PHAB. Or best practice might be that you make sure, as you're writing them, that the goals and objectives of those plans are mutually reinforcing. So you want to be making sure, for example, that if you have an objective in your community health improvement plan, that you have in your quality plan and in your workforce plan elements that will allow you to achieve those objectives. If achieving that objective is going to require competency in a certain area in your workforce and that competency area is not strong yet, then you're going to have to build that into your workforce development plan and so forth. So think about these things as being mutually reinforcing and helping one another rather than living in silos. Next, you're going to write the plans before you send your statement of intent. Well, certainly that's important that that be done. But most importantly, best practice would be that you begin implementing those plans before sending in your statement of intent, because as I said earlier, that's going to show you where the gaps are, where those plans may not be well aligned, and what you can be doing to improve upon them so that you really have a well-oiled machine that's working well by the time you get around to a site visit. You're going to develop plans within designated teams. Now this is a very typical practice. Many health departments have to spread this out and divide and conquer and put certain teams on certain plans and on certain parts of accreditation preparation, and that makes a lot of sense. But in terms of best practice, very important that this happen in a simultaneous way and that they be iterative, that those teams, even if they're focused on specific areas, are talking with each other and are responding to what each other is doing in an iterative fashion so that those plans roll out and are developed and then finally implemented in a way that is coordinated. You're going to, of course, think about ensuring your performance management system complies with PHAB standards and measures. Of course, you're going to do that. But what you ideally could do is use your performance management system, as I mentioned earlier, to manage progress on all of your plans and to identify opportunities to improve implementation as you go. Identify opportunities for quality improvement projects that might emerge from that. You're going to, of course, prepare your teams and your departments for the site visit when it's coming. But most important, best practice would be to articulate how each of your divisions and teams and staff members individually contributes to a culture of performance improvement, because each of them is going to need to represent that culture and that approach during the site visit and long after. And then lastly, if you are asked to write an action plan, you may do it grudgingly and you may deploy it apologetically. You may be feeling a little resentful about being in that position. Very understandable. But best practice really would be to view the action plan like you would a QI project. It's an opportunity to improve and to use a Plan, Do, Check, Act and QI tools to get a better outcome than you started with. So I'm going back to this graphic. You'll remember we talked about the circular approach to the steps. And I don't want to make this too complicated, but I want to show you kind of how this can play out. Not only are we talking about just thinking about preparation and going ready for step 2 and step 3, but we're actually thinking about all of these steps as we're getting ready for all of the others. And likewise, thinking back to preparation as you're in each of these, because of course you're going to be returning to accreditation to preparation when it's time for reaccreditation. And you can imagine I just did all of these 12 lines, but you can imagine that for each of these steps there are a similar set of 12 lines going to all of the other steps. So there's a lot of different communication and a lot of different referencing across these steps that needs to be happening in order for best practice to really be in place. And David's going to tell us about the toolkit that is underway.
Yes, so I'm going to come back to my question that I raised earlier. How do I get started? And so I'm going to give you a little framework for becoming prepared for accreditation, or how to go through some steps to help with that preparation step. PHAB is working on a toolkit, and this will be located on our website in the future when it's ready to go. So here's the process that we have pulled together as far as what we've heard from many applicants and those working with applicants providing technical assistance. And the second, third, and fourth part of the framework there, I will say that we have heard universally that you've got to have these things in place before you ever apply, and you need to know these to be successful as you go through the process, and do it more than a check the box, but to keep in mind that performance and that quality mindset as you go throughout. So throughout this getting started, it is you're gaining more understanding and more knowledge about the process, about your department's application to that, the way it will apply back to the department, what you're gaining from it, how you're developing, so forth and so on. So the first is just become familiar with the process, with the documents that PHAB has, and reading through the guide and knowing what the steps are, looking at the standards and measures and reading through that and getting an initial understanding of that, and what documentation you might have that could work for you. The glossary and acronyms document that goes with the standards and measures, the agreement language that you must have the help director approve when you apply, which also can be found on the PHAB website under the Overview tab. So all of these things help in getting a couple of things underway initially, helping to determine how this will work for you and what you're going to do with accreditation, but seeing if this process is right for you to go through, or use it to begin to do some quality and performance types of activities in the department. So getting that good understanding is the place to start. Second is building support, and it's critical to have this to go through the process. And it's going to take some time to build that, especially if you have those that don't see the value of it and are not sure what you're going to gain. So you have to develop those things as well. So having strong support at all levels, as you see here, with the leadership of the department, the governance, the Board of Health, or the commission, or city manager, whoever that might be, that would give the approval for this, the staff throughout the department that will help in pulling together the department and the documentation and the site visit, all of that's got to come into play. And, you know, there are questions you can ask here, and it ranges from whose idea was this to, okay, how is it that progress is being made on communicating what's going on? How do we assess our support? Who's on board? Who's our champions? All of those kind of things. Then determining why you're doing this. You may be doing it, or the department may be doing it primarily because someone said we're going to do it. And we want to stay away, though, from this check the box and keep away from anything that's not a performance-minded culture being developed. And you can't just go through the motions and get that right. I mean, you can go through the motions perhaps and become accredited, but what does that get you? So up front, you need to decide, okay, what do we want to achieve? What are we trying to accomplish with accreditation? What's the goals that we have it? What kind of benefits do we see? Why is it important for us to do it? And if you can't figure that out, then don't go through the process until you do, because that can set the tone for how you look through the standards and measures and these other aspects to see what it is that this will help you accomplish. Finding the resources, and what are the main resources? Of course, time and money. There is a fee for accreditation, and it's not cheap. That's why having support and knowing why you're doing this is so important. But it's also important to view this as an investment, not just to get accredited, but to improve the overall effectiveness of the organization, the experience of staff, the development of staff, and the health of the community. As we say, achieving accreditation is not the end point. That's really the beginning. It's a snapshot in time. So where is the department moving forward from that? Applicants have found funds for fees from a variety of sources. There have been some departments that have been fortunate to have allocated funds from their governing entity, grants, local foundations, state foundations I know have helped with that in some instances, hospital health systems, preventive health and health services block grants. There is a wording in CDC contracts that funds can be used to help in preparing and paying for accreditation. And there are other possibilities that could be explored. Also, technical assistance from outside the health department can help you in defining areas that you can seek, as well as helping you through any parts of these steps. Setting up an internal structure to go through the process is another part of preparation. As we mentioned earlier, the health department will select a coordinator to lead the process and be the liaison with PHAB. PHAB recommends an accreditation team to help the coordinator and hopefully serve as champions in the department. Using the readiness checklist is a great way to review how prepared you are. It can be used as a means to assess and improve and track your readiness, and the list can just be used as kind of a checklist of things that you need to consider and think about as you go through preparation. This also is found on PHAB's website, and it's under the Accreditation Process tab. Watching the PHAB online orientation is also a good way to get a sense of the process and to get a beginning feel for the standards. And then another element to consider is how the department's going to manage its documents, especially if they don't have a good electronic file system set up. Where they're going to be, who can get access to it, what's the version control, who's going to manage a certain set of documents and approve them, etc., and so forth. So that needs to be thought about as well. And then finally, once you have these beginning things, it's time to prepare and get going with aspects of preparing the agency to apply. Do think about how you will progress through a timeline based on deadlines of the guide, but make it flexible. We've had some applicants report that their director says, for example, in June, that he or she wants the department to be accredited by December. Well, that just lacks a knowledge of the process and the various steps, because there's just no way that's going to happen based on the time it takes to complete the various aspects and activities of accreditation. Learning the standards and measures and make sure you have that right understanding is very important. When a department has nowhere else that it knows how to begin, I always say start with that review and beginning to learn those. Assign domains to leads and spend time getting to know what the measures require and how the agency might fulfill those requirements. Another thing is to begin that early collection and assessments of documents that will be used as potential evidence. The time is to start now, not once you're in that doc submission phase that we showed a while ago. And Margie showed in that circular approach that there's documentation involved in all steps of the process. And so begin the thoughts around how documentation will be handled during this preparation phase. So here are the plans and systems. We've referenced these a couple of times, and here's the measure or standard where they can be found. These are what the new agreement says you're working on or you have in place. Now, the risk communication plan is not mentioned, but it is one of the 8 required plans. So in the agreement, it's, do you have your CHA, CHIP, and strategic plan finished? And are you well on your way with the QI plan, workforce development plan, your emergency operations plan, and your performance management system? And then another addition is your branding strategy, which comes in domain 3. So here's a couple of questions to think about for anyone who's considering applying as they're going through that preparation. You know, are you ready to apply? What's your understanding of the process and of the standards? What is the status of your plans and systems? Are you working on those together? And I will tell you that what Margie mentioned as a best practice is also a documentation principle. And that is that these mutually benefit each other. They are built together. They're not contradictory in any way. And so that is something to consider as you work on these. And then finally, are you collecting, are you selecting, are you creating the documentation that you will need?
So on this slide, we have some resources that relate to the conversations we've been having. Again, in your handouts, you have access to the slides, so you'll be able to click on these links. But just briefly, we've been talking all this time about PHAB's guide to a health department initial accreditation. The guide is available on PHAB's website, and there's a link here for that. The table that David referenced, the summary of changes to the PHAB accreditation process. Also a link there to take you to that table. He showed you a slide which is a snapshot of the first page of that, but there's much more to that. We have a link here to PHF's accreditation technical assistance and training resources. Lots of opportunities for customized support for health departments that are at various stages of preparation. And finally, our PHF's accreditation support resources, our online resources that lead you to all kinds of self-help and exploration of our webinars, toolkits, and so forth to help you along your way. So at this point, we wanted to open it up to questions, and Vanessa, I guess I'm going to let you be the MC on that.
Yeah, thank you. Thank you so much, Margie and David, for those really great presentations. We have a pretty big array of questions. I just sent one out. Our first question that came in a little while ago was wondering about the time frame for hearing from PHAB after you register. I don't know, David, if you have an answer for Belinda.
Yes. So after you submit your registration, then generally PHAB works to have those reviewed and accepted within 48 hours, but within the first week, business week after we get that. So when you first register in the system and start your account, you won't hear anything from PHAB until you finish that information and actually submit the registration to PHAB. And then we get to that as quickly as possible.
Okay, great, thank you. We had two questions that were very similar, that were people wondering what the average time frame is between application review and invitation to in-person training or to site visit. Do you have averages for any of those time frames?
Yes. So the general average from application being submitted to having the site visit is roughly 18 months. But that just varies based upon the time that folks take. Now, I'll start with the application being submitted and the next in-person training. So we hold those quarterly, and we have added extra ones if we have enough in numbers. But generally, the training, and I hope I don't get confusing on this, the training is 6 weeks after the quarter in which you apply. And we do have a calendar on our website that shows our training schedule through 2017. But just to give an example, let's say that you complete your application in February, and so that's in the first quarter of the year, and we will take all of those applicants during that quarter, and they will be invited to the May training, which will be held 6 weeks after that quarter ends. So just to give a little bit more, if you apply in January, then it would be May before we have the training you would be invited to. If you apply at the end of March, then it would be 6-7 weeks until that training. So based upon when you apply, that's the timeline there. As far as the site visit and the time for that, generally it is going to be anywhere from 6 to 7 months after you submit your documentation. And that is going to be related to the amount of time needed during that completeness review. So that's 30 days, or it could be up to 30 days. Also, the pre-site visit review, that could be up to 30 days. And then also how long it takes the site visitors to get through the documentation. And the lesser corrections that you have, the faster you can get through those review times. And while the site visitors are finishing up, the Accred specialist that's assigned to a department is working with the health department on dates for the site visit, and based upon scheduling and when everyone can get together, that could also affect any added time that might be needed before the site visit can be held.
Great. Thank you so much, David. We had another question that came in before the webinar. What can we do to avoid getting an action plan, or if we get one, what's the best way to approach it? Margie, maybe you could answer that for us?
I'll certainly take a stab at it. So I think one of the first things that David said at the start of the webinar today was the way to avoid an action plan is to really prepare, to over-prepare. And so that's a very quick answer. But what you want to be doing, and I think the whole sort of message and purpose of this webinar today is to say that an action plan, if it comes your way, is not a badge of failure. It is a moment of recognition of where you can apply performance-mindedness and perhaps didn't apply performance-mindedness in the preparation steps that you took prior to that. Those with action plans, as David said, for the most part, do ultimately achieve accreditation. So these health departments are using the action plan as an opportunity to address gaps in their own understanding and in their own preparation, and to help them to actually be in line with the aspiration that PHAB has set out. So I guess part of my answer is that I take issue with the question. None of us want to see health departments en masse having action plans, but that's because we want health departments to have done that work in advance. If you find yourself having an action plan, it's an opportunity. So the related question is, well, what do I do if I have one? And what I would say to you is, think about performance-mindedness. Think about, okay, how can I approach this with critical thinking, with looking closely at my assumptions? How can I do this in a data-driven way? What was the basis for the action plan? Based on what data or the absence of what data? How can I be running to criticism and using self-examination to really take advantage of this opportunity? And what does it mean about my customer responsiveness if I'm resistant to addressing this action plan? So we all know the action plan moment is going to feel like a letdown. We would all love to be able to get right to being accredited following that site visit without any delay. But what we want you to recognize is that all of us are learning. And even after you're accredited, you're still in an improvement phase. You're still learning. And action plan is an opportunity to get ahead of that. So if you're asking the question, how do I avoid this? I guess I would say avoid it by being over-prepared. But if it happens to you, see it as a teaching moment.
Thank you, Margie. That was excellent. I just sent another question out to everyone. Someone asked, didn't they change the time to submit documentation to 6 months, or is it still a year?
Yes, that remained at 1 year.
Excellent. Thank you, David. We also had a question from Torney. What are the motivations for health departments to continue to be reaccredited?
That's a good question. I'll start with a couple of things and then let Margie jump in. And I will say that part of what PHAB is going through now is an aspect of an external evaluation that is looking at these questions of, does it make a difference? And that's probably part of that same process that you start with for initial accreditation. Is two or three things. One, why are we doing this? Do we find it a benefit to us and what we are working on as a health department? I think that continuing with the process is going to help continue that mindset of performance and quality. I know that part of what reaccreditation is going to look at is beginning to have departments focus in on some health indicators and status indicators and how they will approach those, and is it making a difference? A couple of things that we have seen come out of initial accreditation through the evaluation gets at aspects of having better community relationships, being able to implement some innovative strategies and having new partners they didn't have before. We did get a fairly significant amount of response that health departments that had achieved accreditation felt like they had financially benefited from it. So there are a few things there, but I guess I would go back to just the process for accreditation. Doing that assessment of what have we accomplished with it, do we need to remain within the system to continue developing those accomplishments and moving forward, and what is it that we hope to continue to achieve and develop and gain by being an accredited department. Margie, anything you want to add there?
I loved your answer. I think the only thing I might add, just to elaborate maybe, is to say that, excuse me, that the accreditation process has been described by many as a surprisingly opening kind of process where your organization may have embarked on it because you were told to do it or because you feel compelled to do it from some external source, your board of governors told you, something like that. But what most health departments who finish this journey find is that they are stronger internally. Their relationships, their ability to get things done, their knowledge about themselves, their openness to rethinking old ways of doing things that weren't working, that all of this seems to take on a fresh color and a fresh beginning through the preparation process. And I know that we're early. We haven't seen reaccreditation yet, but I have to believe that continuing that on an ongoing basis every few years has to be a way of refreshing the thinking across the agency and keeping that that spirit of aspiration going. You know, I think I can't tell you how many health departments I've talked to where there's a description of staff that have been there forever and they don't see any need to change and it's not broken and we just like the status quo. And I think we can all understand how an organization can get stuck in a rut like that, where they're not really looking at how to improve. Accreditation offers the opportunity to, on the one hand, be mindful of what's going on across the country that may be relevant to your own organization and that may apply to your organization, and at the same time being very aware of the local needs and how you're responding to them in a very local and specific way that is aligned with the standards that are being applied across the board. And that kind of mindfulness can only improve all of our performance. So I don't know if that's an argument that, you know, can convince someone to make a financial investment year over year. But I think in terms of the performance of the agencies, it's not an argument that anybody has been able to refute.
Thank you, Margie. Those were great points. We had two questions from Sheila. One short question, just to clarify, Part 2 of the annual report is not required. Is that correct?
It's a part of the annual report, so I guess it is a requirement to send it in. There is no status type of issue if you don't send it in. And of course, if you don't send it in, then it's not reviewed and you don't get any kind of feedback as far as how your quality improvement program is proceeding. So it's a part of the report, and it should be sent in with part 1, but there's no penalties at this point if you don't.
Okay, that makes sense. Thank you. She also asked, will there be an in-person training for accreditation coordinators before reaccreditation?
For departments going through reaccreditation, I'm guessing, and that's unknown right now. When the process and everything is approved by the board, then we will make the determination if there's an in-person training that goes with it. I do know that we have already discussed some webinars. There will be a couple of those in early 2017, and then others as needed.
Okay, thank you. Yeah, we got a couple of questions about reaccreditation. I should also say that the webinar, we have about another 10 minutes or so that we'll be on here, just having this Q&A with David and Margie, so feel free to join us for the rest of this. The webinar goes until 2:30. We do have quite a few more questions. I don't believe that we'll get to all of them, so we'll make sure to address them individually and make sure that everyone's questions get answered. So thank you all for taking the time to submit those. Make sure that you grab Margie and David's contact information as well. So I have a question from Jackie. She asked, how does the training differ from the PHAB orientation? Are they both in person or online or a mix?
Yeah, the orientation is online, and it's a 4-part. It gets at a description of the process, a description of the standards and measures, and then an introduction to accreditation. And then there is one that is specific to accreditation coordinators, which talks a little bit more about the responsibilities there. The in-person training is 2 days, and the focus of that is on steps 3 and 4. So we talk about the development of documentation, how to present it. We get into PHAB, and we have some case studies where participants actually work within the PHAB environment and get used to using that and have time to look at it and ask questions. And then the other key focus is on the site visit, preparation for that, requirements, what happens, getting ready for interviews and the like.
Okay, thank you so much, David. Margie, we have a couple of questions that I know that you will be able to answer about performance management systems and performance management plans. So Ashley asks, how can we measure the effectiveness of our performance management system? It's not completely developed. It seems it's part of trial and error. And then she also asked a little bit about the difference between a performance management system and a performance management plan.
Okay, let me take the second question first because it's just a simpler answer. So really, a performance management system is what happens when you take a plan and you put it into action. The plan is simply what you've written on paper about what you want your system to do, and the system is itself up and running and dynamic and producing data for you and producing reports and allowing you to monitor what you're doing. Can you state, I'm sorry, Vanessa, the first part of the question again?
Yeah, so she also asked, how can we measure the effectiveness of our performance management system?
Okay.
It seems it's not completely developed. It's also part of the development is trial and error, so how do we measure that?
Well, I love the use of the term trial and error, right? Because what is performance improvement if it's not trial and error? PDCA, it's trial and error. It's informed trial and error, right? You're getting data, you're using that data to inform your decision making. But at the end of the day, you're never going to know if your system is finished and it isn't really ever finished. What you're doing is constantly improving upon it. The question that you're asking is, how do we know if our system is doing what we want it to do? You have to set those objectives out in your performance management plan. What do you want your system to accomplish? For example, do you want your performance management system to produce monthly reports for you on certain measures, quarterly reports for you on other measures, annual reports for you on yet other measures? Do you want your performance management system to send report information out to certain people or certain groups, or do you want that to happen in a more in-person kind of way? Do you want your performance management system to flag you when a particular measure goes out of the target range or goes into a danger zone range? These are all questions that you're going to ask yourself as you're setting up what you want your system to look like. Then whether it's doing that is a matter of you monitoring whether in fact it's accomplishing that goal. You also have to come back at it after some time and say, well, those were our initial goals for what we wanted it to do, but is it really necessary that it produces a red flag every time something goes outside of a designated range? Or is that something that division, that department can look at periodically and not necessarily have to have a report generated? So these are very dynamic questions. We learn as we go. There is no one right way to do this, and so there's no one right measure to tell you if you're doing it right. You determine what that means and what you want it to do for you, how it's functioning for you. It's a tool that you're creating. And so you can monitor it the way you would monitor anything. You can create measures that track how well your performance management system is performing and is informing you and whether or not you're using it. So for instance, let's say you have a measure in there and you're gathering those data and you're following the periodicity of gathering those data on that measure and you're reporting out those measures. And you may even be not meeting your objectives on those measures, but you may find that time and again other things take priority, that although you may not be meeting your objectives or your standards or your targets on that measure, it's just not the biggest burning platform you have. Other things are always coming first. Well, all right, so at some point you're going to want to look at that and say, does that need to continue to be a measure that's in our system? If we're never going to respond to it, even when it's off target, maybe it's not as big of a priority as we thought it was. Those are important practices to have in place so that you're not just creating a system and becoming a slave to it, but that you're using your critical thinking on how it's serving you and whether it's meeting your needs.
Thank you, Margie. We have another question. Somebody said, I've been telling my overwhelmed staff that accreditation is about improvement, not perfection. Do you think that messaging is helpful? Any key messages you would recommend sharing?
I love that, and I'd like to repeat it and use it myself. It is about improvement and not perfection. You know, one of the images, I guess, that comes to mind for me is the image of a compass and the arrow always pointing to true north. But true north is a relative thing, and there's no absolute true north. There is no absolute perfection. And in fact, when we're trying to navigate toward a target and we're using a compass to help us, we're going to run into obstacles. There's going to be a mountain there. There's going to be a highway there. There's going to be a river there. We're going to have to figure out how to navigate around those things. And so that might take us off course a little bit, and our compass may be telling us that true north is in a slightly different direction while we're navigating around it. And so there is no ever knowing if you're on exactly the right path, and in fact there is no one right path. You can only use it as a relative reference. Are you headed in the right direction? And if you're aiming to get in the direction you're headed, then you're doing it right. And there will never be a time when you're perfect. That is not the goal.
That's a great answer. I completely agree, but I might be a little biased. We have a ton of other questions. I'm so sorry to everyone. We're not going to be able to get to all these, but we will definitely follow up with you. So we had another question from Jackie, who is asking, as a new coordinator comes into a position, would the training become available even if the health department was already accredited?
Say that again for me, please.
Yeah, a question from Jackie. As a new coordinator, I assume accreditation coordinator, comes into a position, would the training become available even if the health department is already accredited?
Okay. It is on a request basis. The way that we have done that is when we get a new accreditation coordinator, they make contact with us and just say, I would like to attend the training. And we do allow that if we have open slots in any given training. One thing though, once the accreditation coordinator from the department has been trained as a part of that initial application, that is paid for by the fees, but any additional people are not. So if a new coordinator wishes to come, then that would be at the expense of the health department.
Okay, understood. We also have a question from Michelle on dating. So she says, it's my understanding that documents must be dated within 5 years in order to be used as evidence. But from which exact date do you count backwards 5 years? Is it 5 years prior to the date of the application?
It is the date for any required documentation is the date that you submit your total body of documentation within EFAB. And so you would count back from that.
Okay, great. Thank you. Another question. There's a couple of folks who have left the webinar, so I'm really trying to prioritize the folks who are still here who have submitted questions to us. So we have a question from Valerie. David mentioned that reaccreditation is to be completed at the end of the quarter awarded 5 years earlier. Could he please talk specifically about what's going to need to be completed, site visit, documentation by that 5-year mark? We have quite a few questions similar to this, so I know this is in progress with PHAB, but whatever information you could give us, I think would be appreciated.
Sure. Right now, the thinking is that the entire process will be completed. That's the submission of documentation, the site visit, and the report has gone to the Accreditation Committee. What I'm not aware of at this point is the timelines for notifying the department that you need to do this preparation and how that notice will come out, but all accredited departments will be notified of the process and given their deadlines. And so, yes, it would be the submission of the documentation in EFAB for the measures that are part of the reaccreditation measures. It would be for the site visit, and there will be a site visit, but it will not be done as the initial site visit. It will probably be a virtual, but there could be cases where it's an on-site as well. And then that report is written and goes to the Accreditation Committee for review. Right now, all of that must be completed and reaccreditation status awarded by that end of that quarter of the 5th year.
I also want to reassure folks that as we get closer to reaccreditation being a reality, I'm sure that there will be opportunities for specific trainings and guidelines and resources specifically related to preparing for reaccreditation, and those things just haven't been released yet because we're still, obviously waiting for what that would look like to be finalized. But I don't want people to feel that there won't be support there. I think it's just a little early yet.
Yep, and the process, of course, will depend on having EFAB ready. I know that work is underway, but as anyone knows who's dealt with building a technology system, you can have issues with that. One thing, too, if there's anyone on that was a part of the first accredited group of health departments in February of 2013, an extra quarter is being added there. So instead of that having to be done by the end of March 2018, it will be the end of June 2018.
Excellent, thank you. I think I'm going to squeeze one last question in here and then we're going to close. We have a question about the changes going on with the health systems. So we have changes going on with overall health systems whereby providers are now encouraged to do some of the work that was previously done by public health departments. So how will this affect accreditation?
There was some request when we did version 1.5 of the standards and measures to do more as far as healthcare integration. That will most likely be a part of the standards and measures on down the line. Two things around that is, one, the new Public Health National Center for Innovations that is housed at PHAB will be doing some work in the area of public health and healthcare integration, and we expect some of that to inform future standards. But the other part, too, is when we did the last, we just did not have enough information yet of what that really means for us. And as we get into more work of doing those services, then it could certainly become either part of the standards and measures or as acceptable examples. There's nothing that prevents that kind of work from going on now, but there are limitations as far as the kind of examples that could be used for accreditation. And that could change in the future as we learn more about what this integration means for the work that a health department does.
You know, I think that the embracing accreditation and taking on accreditation has afforded many health departments an opportunity to look anew at their partnerships with all kinds of organizations in their communities, and healthcare partners certainly are one of those. Whether it's as part of the health assessment and health improvement planning and implementation process, or whether it's as part of a broader communication endeavor, or whether it's as part of ongoing prevention and continuum of care coordination, those partnerships are critical to the success of both systems. And accreditation seems to be a bit of a catalyst in getting those partnerships reinvigorated. And so I look to accreditation not so much as requiring that, but really facilitating that and fostering that in a good way.
Wonderful. Thank you so much, David and Margie, for your time today and for this really important technical presentation. And I think it showcases from how many questions we have, how many people are really paying attention to this right now and are thinking that this is important for their organization. So thank you all for coming. We have recorded this webinar. We're also looking at a way to record these questions and answers, and we'll be sending it out in a follow-up email to all participants, and it will be archived at phf.org. Thank you all for coming today. Have a great rest of the afternoon.